So, what exactly does it feel like to have very large testicle implants like this one here? This is a custom 7.5 centimeter in length implant. It's one of the biggest ones I've put in, and I recently followed up with patients who'd gone for large custom sized implants to ask them how they're doing, how they're progressing, and get in their words what exactly it's like having implants put in that are this size. So this is what they told me. In our practice, we always use the extra soft durometer testicles, like these silicone ones, because the saline ones tend to be poorly tolerated and too hard. A lot of men still find these, even the extra soft ones, quite firm. For example, a comment here is, I was worried the testicles would be too hard, although they're indeed firmer than the testicles themselves, the original testicles. They're quite squishy and bouncy. So in general, I find that the silicone implants are very well tolerated. So, the universal theme for the first couple of weeks after surgery is the swelling can be a lot, and this is definitely true. There's not a great way to elevate the scrotum after surgery like you would, let's say, a hand, so the swelling is usually something that you just have to deal with. One patient says, for example, the swelling was an experience. I think the swelling and cramping were quite intense at times. The swelling made the scrotum one big ball, but with time, you could start to see the natural formation of the scrotum around the implants, and it looked much more natural apart from the size, obviously. So typically, there is some variation in how much swelling and bruising a patient gets, but it can take quite a few weeks for it to settle down after surgery. Hand in hand with the swelling is, of course, a high and tight scrotum. This is a very common complaint, and in some men, it can be very useful to put Botox throughout the scrotum to help relax this. Unfortunately, however, the Botox needs to be repeated usually about every 6 months, but the gravity of the testicle implants themselves can help definitely with time. I always advise men the first 3 months the scrotum is usually going to be higher and tighter than usual, and then with time it will relax. One man's experience was a tighter scrotum has been an area I'm still working on. It's not painful at all, but trying to get more of a teardrop shape than a ball shape. That is something very common men express to me. I noticed that if I use a lot of lotion and wear a leather nut stretcher in the morning, for an hour after the shower, then the scrotum is more relaxed throughout the day. Another thing some men do will, for example, at nighttime, is when they're relaxed, they'll do some massage and just basically push the implants down there and encourage them to be lower in the sac. And this can help speed up things, relax them, get them down into a nicer position with time. So what's it like having sex with implants this big? So thankfully, I've never heard any men express any issues with that. And usually because they're happier with the appearance of things down there, overall, most men report that their sex life is improved. And an example here is sex is good, really doesn't feel like the testicles are giant, doesn't feel weird at all. What's it like participating in sports with a pair of implants these big or this big? Nobody I talked to complained of any issues with their workouts and sports. One man, for example, says, no trouble at all in sports. I run, bicycle, swim, do yoga, no problems. A couple of other things men have mentioned to me, which I wouldn't have expected, is they have to, for example, buy all new underwear because they find the pouches are too small in their previous underwears. So maybe don't invest in a lot of underwear if the surgery is in your future. And then something else I've noticed recently is that, in fact, it seems that the new TSA body scanners are more sensitive. I looked it up. That seems to be the case, that more sensitive scanners have been phased in. I've been doing testicle implants for 10 years, but recently 2 different patients have expressed to me that TSA noticed their implants. So from now on, we're supplying all patients with a letter explaining that these are medical devices and when they were placed, that sort of thing. So that is something unexpected that we are seeing more commonly. So typically this surgery, we're based in Miami, Florida. This is used to enhance the scrotum and the appearance of the testicles in patients. Typically the off-the-shelf testicles go up to the size of the blue one. These are number 5, but we've been talking about the larger custom testicles like this, which are very popular as well. We're accepting consults for these. Usually when patients get them placed, they're in Miami with us for about a week. Typically the downtime is 1 to 2 weeks, of course, depending on the patient's job. And we place the implants through a small incision towards the bottom of the scrotum and place them big enough so that they hide the natural testicles, which we'd leave alone. And that's how we do testicle enhancement.